Hello, this is Athena Jezik, and today I'm showing you a class that I am having with two apprentices here in the Austin area. We're going to go over the very basic work and help to get the foundation very established for you to be able to understand this work a little bit more clearly. So we're going to begin with, I first want to say that all the credit that I am teaching you goes to the Upledger Institute, Dr. John Upledger. I want you to know about him, and if you feel you wanted to go into his courses, please do. They're very good. But what you're getting with me is in the integrity of what John has taught. So the Upledger Institute is where this material is coming from. This is where the chart comes from. And I wanted to give credit due where credit is due, because this is not really my work. This is the work that I have studied under. So to begin with, we understand that the cranial system is basically the membrane that goes around the head and down the spinal cord to the sacrum. So all of this is what we're going to be aligning. Now, there's very little tiny pieces to all of this that you can learn in time, but basically what's important is for you to get this work in your hands and also have a visual in your mind as to what you're doing, because that will help you, and that will also, you will find that your intuitive parts, as that develops, will be showing you a lot more. So this work is intuitive in some senses, but you also have to understand the science behind it and the techniques behind it so that you can apply it properly. It's important also to be able to get your mind out of the way and let your hands do the work and let your intuition speak to you more than your head trying to fix something, because we're really not fixing anything. So when people walk in to me, of course, some of the stuff I've done over and over and over, which has, made it so I kind of know what I need to do. It's different for everybody, but I basically know what I need to do, like with sciatica or something. But I always look at the person like I don't really know. I kind of don't even know what I'm going to do, because I want to wait for that intuitive sense to kick in and for me to just focus on the body and to be able to follow what the body is saying. So it's very important to develop that. That will give you an edge on being a really, really good therapist in the long run. But it does take time. You have to get it in your fingers first, and then from there it just will develop. It just happens. And John has even validated that by telling me, just get it in your hands and all the rest will come. So I'm not going to spend too much time on all this other stuff. It's a lot of names and things, and you can find those in anatomy books. And so keep getting an idea of what these different structures look like. This is the membranes and the different bones and how it works around the brain and in the different parts of the brain, the mammalian and reptilian parts and the sphenobasilar junction. We're going to go through all of that. So I just wanted to let you see on a chart that the cranial system is basically the membrane that goes around the brain. It attaches to various bones on the brain that do move, and then it aligns down the spinal cord to the sacrum. L5-S1 is another very important joint that I've discovered that is important to keep in alignment, along with this phenobasilar junction, which is right here, which I'll show you on the skulls, because that is the fulcrum of the body. So when those two are aligned, then the rest of the body can be aligned. When there's something off in the head or in the tail or anywhere throughout this whole system, these little dural tubes that come out from there are going to be pushed to the side, twisted, whatever the injury is. So the whole idea is to get small traction going with that, stretching that tube back out so that it aligns. The energy will flow better. The energy to the body through the nervous system will be able to kick in better function with the body, with the organs, and all of the stuff that the nervous system feeds and loops back into the brain. So it's really an important thing to get that in your head, that's what you're doing. You're at the core of the body. You're working at the very, very core of the body. And it's energy, it's also subtle anatomy. So that's why I have the course, the subtle anatomy course, because to me this is a very, very important part of being a very good healing artist. I like to call you healing artists because an artistry is beyond the normal. So I did mention the dural sleeves and the the dural tube. So I wanted to just show you on some bones because it's a little bit different than a chart. This is the way that people will lay for the cranial session. They lay on their back. But I'm going to flip this over because you can see the spinous processes here of the vertebrae. This guy isn't in super good alignment. But then there's these little dural sleeves that come out here. And those are it protects the nerve along the bone. So it's a dural tube, but they call them the dural sleeve, and then the nerve is inside of that, and it will go to the organs in the various places. So if you wanted to deepen your study, you could figure out where, the different parts of the spine, what organs they go to. It doesn't really matter, you're going to be looking at anatomy books, hopefully, to just kind of keep getting that visual. But the dural sleeves are the parts where the nerves come out. So when this is twisted or turned, you can kind of see vaguely how that would affect. This side would be different. It would be pulling in. This side would be stretched. And so sometimes maybe odd pain that you might feel or your client might feel could be because of a dural tube that's being, or the nerve in that tube is being a little bit compromised. So that's what's important there. I mentioned L5S1. This is the last lumbar vertebrae. This is the first, the S1. This is the sacrum, which is it's fused here. There's these bones that are fused. And then the coccyx, which is the tailbone. This part right here is very important, and we do work with that when we do the sacral pull. And that's where you want to get your fingers inside of that and actually access that dural tube that's right here. This is the dural tube. And so you want to be able to get your fingers in there and access that. And when you access that, then you kind of hold it with that 5 gram of pressure, and you'll traction it just slightly so that you can get a stretch. Now, when you do that, you don't need to start out knowing to do that, but as you do that, as you move along on this work, you will know if there's a stuck place farther up the spine, because the tube will stretch really nicely, and then all of a sudden there might be something that's way out, and then it'll stop right there. So all you do is you just hold it there, and oftentimes you're going to feel a lot of movement going on because it's unwinding, and then it'll start to stretch again. So you let that stretch happen. You can also do that at this other end, up here at the occipital base, and this is what I'm talking about when I will show you more of the technique. But you'll be accessing this part of the dural tube right at the base of the skull. So your hands will be underneath their occiput, and you're going to be accessing that in this kind of a similar way with your finger. And you'll have your fingers on each side, and again, you'll be tractioning that dural tube just slightly, and that same thing will happen. You'll feel where there's something going on in the spine. So that is an important thing, and that will happen after you do the diaphragm releases, and oftentimes where that restriction is where the diaphragm, what we call the diaphragms, those bands that go around the body, like a whiskey barrel, the metal around a whiskey barrel. That's where it's connected into the vertebrae, and oftentimes that's the location where there's probably the most restriction, simply because of the nature of that particular tissue. It's more connective tissue. It holds you in place. So that's the dural tube, and these in between here are discs. Now the discs, I'm going to mention this in this part of the course. It's much more advanced, and it takes a lot of work. But I have worked people that have had disc issues when they've been slipped. It's a little bit different problem when the disc is deteriorated, because then there's nothing there. But when they're just slipping out, I think this is a chiropractic. So it slips out, kind of looks like that, this little kind of goo that sticks out. Well, if you traction long enough, it takes a long time to do that, and it's kind of uncomfortable on the therapist, but if you traction very gently, it will eventually open that vertebrae up enough to where the disc can slide itself back in. And I've seen that happen with 3-disc problems when I went over to India. So when I was called to go to India, I was there to work on somebody that they had said they had sciatica. Sciatica is a very easy thing to pull out as a general rule, unless there's other complications. But it's fairly easy because it's just a misalignment of the sacrum and the sphenobasilar junction. But when I got to India, I realized that this was a lot more serious than just the sciatic pain. Yes, the sciatic pain was there, but there was also, in one man, there was 3 discs that had been slipped or bulged. And he was on his back for about 2 months, just flat on his back. He couldn't move at all. I mean, his wife had to help him with everything. He couldn't turn. He couldn't do anything. He was in excruciating pain. And so I was like wondering if I did the wrong thing by going there, because I had never worked on that kind of a serious issue before. But I followed my intuition, and I was told just to traction. I worked on him the first time for 2 hours. I was probably tractioning his sacrum for an hour and a half. I got that through maybe an hour and 15, 20 minutes, but I got through the head. I did everything else, but then when I got to the sacrum, I just had to traction, and I had to keep tractioning until the body was really telling me to stop. So it was very excruciating for me because it's a very uncomfortable position, but I just kept moving myself around and keeping that same pressure of a 5-gram stretch on the dural tube. So actually, after 2 hours, he was sleeping through the whole thing, so he just had a great time. And after the 2 hours, he came awake, and I asked him how he felt, and he said, "I feel really different." And then I asked him if I thought he could kind of just sit up a little bit. I was expecting him just to take a very little, slightly sit up. He sat all the way up on the table. He was just sitting up on the table. His legs, he swung them down on the side of the table. And I said, "That's really good." I said, "How does it feel?" He goes, "It still hurts, but it's different." So I said, "Do you think you could just slide down and just stand for a minute, and I'll be right here to hold you if you need, and or just stay on the table?" He slid down and he stood up. And I was shocked. I was absolutely flabbergasted because I had no idea what had gone on under my hands. I just know that it was a long darn time that I was there pulling that sacrum. And then I asked him, I said, "Do you think that you can take maybe a step, but be really careful, I don't want you to fall?" He took 8 steps. He took 4 steps out and 4 steps back, and then he got on the table and he said, "It hurts, it still hurts quite a bit, but," he said, "it's changed, and this is what I can do." The second day, he walked outside of the door. He had a staircase. His family was there, and they were like, when he walked out, their jaws dropped. I thought I was going to have to get a chisel and chisel their chin off the floor. But he went up 8 steps and came back down 8 steps. And then the third day, he got in the car and came over to where I was actually working. So I know this can happen. Again, he had his discs in place. They were not deteriorated. So there are some times that this isn't going to work as good as other times, depending on what's actually happening there. But if it's just a slipped disc and the disc is just out of alignment, getting that vertebrae back into position and allowing the disc to be able to have space to move back in, the body has an incredible ability to heal itself. So I just want you to all know that, and I am going to show you how to do the sacral pull to help with sciatic pain as well. But that takes a lot of work, and it takes a lot of patience, which is something that you get to develop with this work, is patience, because you can't rush the body. And you'll find that the deeper you go into listening to the body, the more entertaining it becomes because you feel so many different things going on. So I just wanted to show you that and let you know that this is the abilities and the power that this work has for you to assist people in their own healing process. We're not fixing them necessarily. We're just giving space and allowing for the body to do what it has to do in order to maintain its correctness. So taking another look at with these dural sleeves, now that we've got the discs all aligned, the dural sleeves, they have the nerves that will go like to the intestinal tract or the liver, gallbladder, stomach, or wherever they go, the lungs and all of that. So if this is out of alignment, then of course there's going to be less of a signal coming from the nervous system, and the nervous system is really everything. That's what starts everything. It's a very important system to be intact. The thing about that is it can start to stimulate a better function of the organ, but there's another component to all of that, and that will lie in the area of what people are eating and how much toxicity they have in their body. If the alignment is there, it can start to correct, but there's other things that people have to do besides just getting their alignment done. The alignment is utmost important, but they'll also have to take a look. So if you're a therapist and you're into the nutritional side of it, or you have other means to do that, or just suggest it, start teaching your clients about the importance of eating well and not taking in toxic food, not taking in toxic medicine, not taking in toxic things like that, because a lot of that toxicity is what is going to break down not only the organ itself, but it will also throw everything else out of alignment because the body is not strong when it's getting fed a lot of poison. So that's another factor of all of this that can kind of fold into your work as you work along. So just be mindful of that. A lot of times when you're working the sacrum, which we'll get to, if you just lay your hands on top of the abdomen, you'll feel things, and pretty soon you'll start to know. Most people are severely constipated, even though they think they're not. There's also other things that we could get into at a later time, such as parasitic infection. Sometimes parasites will block certain things in the intestinal tract. So there's a lot that can take you on many, many paths of what you can do. And you can actually, you're not really diagnosing people, you're not really doing what we're not supposed to be doing, but you can educate people to what they need to be paying attention to, and the body will, I absolutely know, it will restore itself to what it can. If there happens to be a rod in the spine, that happens sometimes, you'll have people that have a rod in the spine, the body will shift itself around and work around that rod and correct as much as it can. And I've seen people with one woman, in fact, that they put it in a little crooked. The next day she didn't have any pain. Unfortunately, she was so hooked on the doctors and pain medication that she let that all slide and she didn't come in anymore. That was back a long time ago, and people didn't understand this work as well now. So those of you that are engaging yourself now into this work, seriously into this work, you will have an easier time with your clients because their awareness, their consciousness is in a different space than it was, 30 years ago. So that will be much easier for you to begin to gently talk to them about what they're consuming. And also I will have a thing on what is important, what the body needs to help rejuvenate itself. There are certain things I've discovered in the process. So that's going to be coming at a later time as well. But for now, I just want you to understand the power that this has, and I want you to get your hands very skilled at the basic work. But I also want you to look forward to where you can take this, because it's going to be a very important thing in the future. I'm going to show you where the placement is on the spine for the diaphragm releases. This is basically where the bands, these bands go around, And that's basically where it is where each one of it is connected into the vertebrae. So you start by going to the lower part of the body, and as you see, there's the two hip crests. The SI joint is between the sacrum and the two hip crests, and this should be, the sacrum should actually be moving with the rhythm, like that. It should be moving. As you're tractioning, you should also feel some rhythm. Sometimes the rhythm will stop because they're going through a process of their own personal manipulations of what their body needs to do, or their mind or their emotions. So sometimes it'll stop and sometimes it'll start, and you can feel it rotating. But to get into the positions of the diaphragm releases, is you're going to go right at the sacral L5S1 location, which this guy's got kind of a deep. Okay, so that would be like right there. You would slide your hand underneath, and you want to be with a hip crest on the hand, and you want to feel the top of the sacrum. Like I say, his sacrum is a little deeper than what you usually find on a body, but it's right there at L5S1. And then the top hand goes on top of it. I usually start kind of high, and you'll take it with the other hand because you don't want to have your thumb flying out there. So it would be like, so I usually start kind of high, and then you want to move the hand down as far as you feel comfortable, too close to this pelvic arch. So you kind of can slide your hand about so, and then you just wait there until you feel the movement happening. And when the movement happens, then that's when you're releasing the diaphragms. The second one is about the rib cage comes around, so it's at the lower part of the rib cage. It's about at L1 and T12 or T12, T11, right in that area. I usually spread my fingers on that one, get it in between, and then slide my hand underneath there, and then put the hand on top. The rib cage is going to be here. You're going to be right below the rib cage. I always like to touch the ribs just a little bit to kind of guide my hand, and then the rest is kind of on the abdomen. And again, you're going to start to feel the movement happening. So this you can practice and do. But this is the first part of the 10-step protocol that's very, very important to open up. Then the next one is the thoracic inlet or outlet, and you go diagonally underneath between the shoulder blades. And so you're like so, and that's going pretty much along the upper part of the thoracic vertebrae. And then that other hand is going to go just below the clavicles, which is the collarbone. So you just have that other hand there. If you want to, you can just kind of hold the finger part of it there. I like to, if it seems comfortable, I like to put my hand a little bit more on the sternum. And you just wait there, and again, you'll feel the undulating, and you'll feel when it's releasing. And even if it doesn't feel like it's a total release, the body will release itself. Just give it a little bit of time to move around, and then the body will release itself. After you take your hands out, it'll still continue for a little while to realign itself. And then the next one is the hyoid, and you'll go at the atlas, which is the very top vertebrae, between the atlas and the occiput, and you're going to hold, I always hold my finger there, and I kind of put my hands, again, separating at the cervical vertebrae. I like to spread my fingers there because it just feels a little more stable. And then you find that hyoid, that floating bone, which is just like below the jaw, and you're going to put your fingers there and again feel that release. Now, the hyoid bone is only held there with muscle, so there's going to be oftentimes a lot of undulating. Sometimes it'll feel like it wants to go to the side a really long way. Just follow it going to the side, and then let it come back on its own, and just let it kind of situate itself, and you'll know when it's time to come off. But you need to spend, on the diaphragm releases, it's probably about 10 minutes or so, maybe 8 to 10 minutes of the of the beginning of the work of the whole 10-step. It might fluctuate a little bit, but you do need to spend a little bit of time on it to give it. So again, it's the patience part. But you also have to be mindful of the timing of the clock too. So I'll kind of mention that as we go on. I want to invite you to explore my course, The Foundations of Subtle Alignment. It is going to take you beyond the work of massage therapy. It will take you into the world of the subtle anatomy. Misalignment of the subtle structures is often the root cause of chronic pain, injuries, and chronically high levels of stress hormones. These techniques offer profound benefit whether you are working on people with complex issues or not. In this course, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures.